Namaste. मैं Dr. Sudha Saini. I am a senior consultant at Apollo Hospitals, Noida, in the Department of Pediatrics. Today, I will be discussing about how to take care of our children's teeth and gums. This is again a very common complaint in the OPD, even including in the newborn period when they are only on mother's milk. That how do we clean the tongue and the oral cavity? So remember, we will begin from the beginning, as in the birth onwards. So remember, the baby who's on mother's milk does not really need any vigorous cleaning, even if it is a cloth or a soft cloth, of either the tongue, and we do not even need to clean the gums. Breast milk as such does not cause us any problems if there is no tooth in the oral cavity. Now, coming to around age groups of 6 months onwards, when the children will start having their primary tooth, which is the milk teeth, that the children will start evolving. The moment there is the eruption of the first teeth, we should start using a baby brush. It could be a small stub of a brush, or there are a lot of finger brushes that we get nowadays, wherein you have a silicone finger glove with bristles on one side, which can be worn by the parent, of course. And these can be started to be given to the child. A child will generally copy the parents, so the parent can start brushing, and even if the child is just chewing on the toothbrush, it is fine and acceptable. The idea being that we dip it in drinking water, because the child might gulp the water and there should not be any concern. And the idea is that we are cleaning the tooth surface of any residue of the food article that the child has taken. This should primarily be done after all meals, including milk as well as solid meals, from the ages of 6 to 12 months. Now, there are a lot of available toothpaste in the market, and we can start using those toothpaste as well. But the idea is, till the child is around 2.5 years of age, we should use only a rice grain size of the toothpaste on the toothbrush, whichever toothbrush we are using. And beyond 2.5 years of age, when the child can spit out comfortably, we can start using a pea size of the toothpaste. This is important because we do need the toothpaste to allow the enough generation of the froth and the soapy content, so that the food particle and residues are well taken care of. In children above 2.5 years of age, we should encourage brushing of the teeth, or at least rinsing of the mouth, or after all meals. And teeth should be brushed thoroughly with the toothpaste after waking up in the morning and once before going to the bed. This routine should be maintained all through the ages, so that the child has less trouble with the teeth and pain-free childhood period. Namaste.